Good morning, everyone. I hope everyone is well. Thank you, Ms. Dalton, for the invitation to speak about equity and partnerships. Next slide, please. So the objective I'm going with today is to define health equity and determinants. I know you've probably heard this several times, just going to give a quick refresher. Identify the role of community partnerships in achieving health equity and give some strategies on and case studies on some things I have done to kind of demonstrate how this can be done. Next slide, please. So I'm going to kind of open up here with the icebreaker just to get some fillers from the room. So what is health equity and what is it not, based off of some of your experiences or views that you may have?
I see Mary Lee. Would you like to, I think you're off mute. Go ahead.
Sure. Hi, everybody. So my thoughts of it is that everyone has access to the same opportunities for healthcare. In that we don't have this disparity among different communities.
It looks like your cat had something to say too. So
yeah, he loves Zoom meetings.
Okay.
Okay.
And Dr. Erves, I'll add, health equity is not equality.
Yes, good answers. Anybody else? I see Grayson stated that health equity is providing the appropriate amount of resources to each person based on their personal need. It is not providing the same amount of resources to everyone. Yes, great answer. So we can go to the next slide because I know we only have 30 minutes. So of course, the World Health Organization, when they define health equity, is exactly what you all stated. It's the absence of unfair, unavoidable, or remediable differences in health among groups of people, whether they are defined socially, economically, demographically, or geographically. And so when we look at this, I love this picture because a lot of times when we think about equity, we don't see the whole picture in terms of equity is actually personalized because everyone has different needs when it comes to getting to having that access to care or health that they really need to be equitable. So if you look at this picture, you know, we have a little child in the front who had a little bike. A mom got the size that she needed. The dad had the size, and then you have one in the back, totally different idea when it comes to riding bikes. And so with that being said, we see that health equity can look in a variety of ways. And so it's not a one size fits all approach. Next slide, please. So in other words, what we're saying is that, you know, we want everyone to have a fair and just opportunity to be as healthy as possible. The absence of socially unjust or unfair health disparities, and the removal of structural barriers to health. Next slide, please. So one thing I wanted to really make sure there's a difference known. There's a difference between health equity, health equality, and health disparities. So of course, we've already talked about what health disparities are, health equity is. So when we think about health disparities, we're thinking about the differences in disease burden or outcomes between disparate groups. So for example, we know that African Americans have higher cancer rates compared to Caucasians. So that's an example of a health disparity. And then the next thing is health equality, where everyone has the same opportunities and resources. So we may provide someone access to screening for cancer, but they may need something else. They may need also transportation to get there. So it means that just because we give someone access to a certain resource, that may not necessarily equate to what everyone needs, that equity piece. So that's just some key differences I wanted to point out as we move through this presentation. Next slide, please. So when we think about equity, there are several factors that play a key role in health equity. And the first piece I really want to highlight here is the societal level, where those policies are being made, where they can actually address the structural and racism and the privilege that we have. And when we look at those policies, they actually filter down, and not just societal level, but community policies that are made at the community level. They can filter down and determine people's actual social determinants, which is that individual and family level. So when we think about equity, we see that it starts with the policy level and can come all the way down to the individual level. So it's so important that we address all of these factors when it comes to health equity. Next slide, please. So there are some challenges to achieving health equity. First of all, we have those structural inequities that we mentioned, where we're looking at the policy, the law, the governments, and the culture. And with those things, they influence our outcomes. Hence why when COVID hit, it became very apparent or shed that light on what those structural inequities are when it comes to us addressing this pandemic. And then when you have the structural inequities, they negatively influence our social, environment, economic, and cultural determinants of health. And so if you think back to that figure we just looked at, how people react in our day-to-day life and our day-to-day environment is actually a reflection of those policies. So structural inequities follow individuals from womb to tomb. I thought that was such a very accurate quote that I saw with Robert Wood Foundation. Next slide, please. So we have some guiding principles when we think about health equity. So the first thing is, in order to address it, we first have to really understand the root problem. So we have to think about the structural inequities. We have to think about what people are currently experiencing in their day-to-day life when we really want to address health equity. The second thing is that we have to build the capacity of our communities and our even our leaders in certain areas to actually be able to come together and combine resources to actually address some of the concerns that we have to achieve health equity. And then the next thing is to align action and resources to solve the core community problems, which is important because especially if we want sustainability over time, we have to come together and work together. And then the last thing, we need the community members' voice throughout the process. We need the community members to tell us what their key issues and concerns are when it comes to addressing certain problems and what their needs are to address those problems so that we can have favorable outcomes. Next slide, please. So what role can community organizations play? I think a lot of times we often look to policy level to say, well, if we just fix the policy component, then it will change how people work in their day-to-day life, or the rules and how things are implemented, whether it's the clinic, at schools, etc. But I think it's important to recognize that as community organizations, outside of policy, you still can work together to actually address healthcare. And so what that means is that you can partner with healthcare organizations to fully understand what the community's needs and assets are. And then you can combine those efforts and share resources to address those social determinants of health that are beyond the direct reach of healthcare. And then the third thing is, we talked about those policies, and in those roles, you can actually advocate for the policies needed to actually support health equity. Next slide, please. So when I saw this model, I thought it was an ideal model that really shows what that process looks like. And as partners, The first thing is, we have to learn to work together. We have to come together. And with that, then you kind of figure out like, okay, so what is it that we're all trying to achieve here? And the reality of it is when you work with different people, everybody, we have the same goal in mind, but we may have a different process of getting there. And we may have to have different outcomes when it comes to our organizations. And so, very much in the beginning, you have to align those needs and come up with a vision and mission and goals and objectives that actually reflect what all the partners want. And that's just kind of a way of reaching the end goal that everyone needs, but also it's achieving equity within the partnership. And so the next thing is building capacity. So after you identify what that mission is and what those goals are, you want to identify, okay, so if we're going to implement something, let's see what we already have in place. Let's map out what our assets are and see how we can work together to reach that goal. And then when you figure out what those assets are and what your capacity is, you actually develop the program that you want to have. And throughout that development process, you have to make sure that the community's voice is at the forefront because you want to make sure that that program is actually going to work in the end. And once you implement it, you're going to work with the community, implement this process to ensure success. And once you have outcomes, you're going to distribute those results within the partnership as well as with the community. And that's a great way to achieve buy-in, but it also helps with your organizations to show that your efforts actually worked. And so for sustainability purposes, you have to always keep coming together, having evaluations. If you need to bring additional partners to the table, then do so. That's important when it comes to implementing a social determinant initiative. Next slide, please. So we kind of just briefly talked about the process and what that looks like, but I think it's important to identify what principles or partnership principles should you establish with the individuals you work with to actually promote equity. So the first thing is that, you have to respect the fact that you have partners at the table and all of those partners are important. They're going to bring something invaluable that can be used to ensure the success and sustainability of whatever initiative that you are implementing. The second thing is you want to encourage your partners to participate in all phases of the process, whether it's research, industry, education, whatever initiative you are coming with, you want them involved in all phases because that's a way of empowering them, making them recognize that, yes, this is our project, and it ensures that this program should have sustainability at the end. The third thing is that information is shared among all partners. Transparency is so important when you want to promote equity. You want to make sure that if there are differences in interpretation, you have to address that respectfully. I think the important thing here is that we have to realize that we may not all see eye to eye when it comes to implementing programs or how that process should go, but it's important that you respect all individuals who are at the table and ensure that people understand your perspective and work together and come up with the best solution to that goal. The next thing is even when you communicate, excuse me, you want to make sure that all people can understand. I think a lot of times we come to the table and we may speak different languages because of the different worlds that we come from. So like for me as a researcher, I work in academia, but a lot of my work is in the community. And so with that being said, a lot of times community members do not necessarily understand that, yes, I have a budget and yes, I have guidelines to follow by grant and I have to implement things a certain way for the most part. I have rules and guidelines to follow, not just from national level, but also at the institutional level when it comes to how projects can be planned or implemented. And so with that being said, I have to make sure that I bring my community partners to the table early on in the process to say, hey, this is the grant. This is what we can and cannot do. This is what I can and cannot budget for. And how would y'all like this project implemented, but yet it reflects what the guidelines are of this funding announcement, if you will. And so with that being said, we have to make sure that when we create these principles, they are equitable in that, yes, I'm meeting my needs as a researcher, but also I'm going to meet the needs as my community partner stresses their needs like I stress mine, but we're also meeting the guidelines that are required by that funding announcement. The next thing is respect partners that they have different assets and needs, and they need to build capacity. And so when I work with individuals, the one thing I think is so important is that if we're going to all be equitable in the work that we do, if one person needs training, if someone needs assistance in learning how to grant write, or if they want to take part in leading our focus groups or handing out surveys, or they want IRB training as a community partner, it is my job to make sure to build their capacity to be able to participate in the work that we do together. Equally so, when I work with partners, if there's things I need to understand, it's meetings I need to be at so that I can understand the culture of the community, it's my community's partner's job to ensure that I am at those meetings and I can understand how things need to go when it comes to the work that we actually do together. The last couple things is that you want all partners to participate in governance and foster inclusion in the work and not exclusion. And so essentially, when it comes to decision making, you want it to be equitable in that everyone has a voice, and that the final decision is agreed upon all parties. And you want to make sure everybody's at the table when that's done. You don't want to leave anyone out when it comes to promoting equity. Next slide, please. So what are some steps you can take to ensure equity? Well, I think the first thing is that when you come together with all partners at the table, I have a 1-minute warning. Is that right?
Yes, that is right.
Okay. So just some steps to ensure equity. Just develop a work plan, your roles and responsibilities, do a needs assessment, create your vision and mission together, your goals and objectives, and make sure you evaluate that program once it's implemented. So yes, we can stop there since we have 1 minute. And I'm sorry we didn't have time for questions.
Yes, I apologize as well, but do you have a moment to put your contact information in the chat so that folks can follow up with you personally if they have any questions? Thank you so much, Dr. Erves. I appreciate that quick overview and introduction into partnering with the Health Equity Focus. I hope others have benefited from that, and I know I did as well. So thank you so much for your time today.
Thank you.